Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll.
Right, thank you very much for agreeing to come and talk to us today about experiences with NCDs, non-communicable diseases, and COVID-19 and how it went through. But before we get into the details, which should be exciting, let's hear a bit of an introduction. What's your name? What do you do? What's your relationship with NCDs? And then we'll pick it up from there.
Thank you for having me. My name is Joan Wangari. I'm a pancreatic cancer survivor. I was diagnosed in 2011. It's now close to 12 years. I underwent surgery and chemotherapy. And in 2014, I was declared cancer-free. Yeah, and I'm also the founder of a group called Hope on Fit. It's a community-based organization where we do support group, where we support people living with cancer.
Yeah. So let's talk about your experience before you were cancer-free. What was the experience like when you got pancreatic cancer? How did you know? How did it present? And then walk us through the process up to when you were declared free of cancer now.
Okay, it was in 2011. I was very young. I was in my mid-20s. My life was going on well. I had a bright future. But now, in this particular day, I found that I was not unwell. I was not feeling, everything was not okay. I was feeling like I was tired when I was waking up in the morning. Then I had this bloatness and jaundice. And I was wondering what was happening. Like a typical Kenyan, I went to a nearby, I didn't go to the hospital, I went to a nearby pharmacist, took some pills because I was itching. That's what made me go to seek maybe some, that's when I went to
pills and creams to see if you can solve the itch.
Yeah, the itchiness. But that one didn't solve. That's when I decided to go to the hospital because the itching was too much. I could itch at the palm of my hands, especially here. I would even scratch on a wall when I was passing by. It was so severe such that I could not sleep at night. I could even cry. I was wondering what was happening. By now I had already lost a lot of weight. Even my neighbors could recognize, even they were asking, what is happening with you, Joan, of late? But I had no answer. My appetite was down. Then I was like, I didn't know what was happening. I went to the hospital. I was misdiagnosed at first because the first step I took when I went to a public hospital, I was living at the coast by then. What they did, they just gave me some pills to eat. They thought it was an allergy to something, which didn't go away. After several misdiagnoses, at some point, I was diagnosed with hepatitis C. I was told it was a hepatitis because I had jaundice. My eyes had turned, everything was yellow. So they thought it was hepatitis. When I went and took the pills, they didn't work. But by God's grace, at a certain hospital, they discovered that I had a mass because I was feeling bloatness. So at first they did the blood test, full hemogram, but find nothing in my blood. They decided to do an ultrasound. That's when they discovered that I had a mass in my pancreas. Then I went to several tests from MRI, CT scan. That's when they were certain that it was a pancreatic mass. That's what they called it before. So after that, I had to travel from coast because by then there were no major treatment that could have been done there, because they told me the mass was so big. Even they were like, it cannot even happen in Kenya. But when I came to Nairobi, I was taken to Nairobi hospital. Surgery was done, major surgery. Then after a month, because they had to take the specimen for the tests, then after a month, the results came out. Yeah, it was malignant. The tumor that I had, it was malignant. With part of my pancreas was removed, the tail, and also spleen was also removed during the surgery. Yeah.
Okay.
After that, after a month, I was waiting. Maybe I go back to my usual business and my usual life, but that was not to happen by then. That's when they told me I had to stay in Nairobi. By then in Mombasa, there were a lot of treatment, like chemotherapy. It was not found in public hospitals, maybe the private ones, and it was very expensive. So I had to stay here. I was put on chemo. That's when I went to Kenyatta Hospital. That's where my chemotherapy was done. From 2012 up to 2014, I did 18 sessions of chemotherapy. And in 2014, I was declared cancer-free. Yeah.
How was the feeling?
I felt so good because it was something traumatizing because I was very young. I had not seen anybody with cancer. I had not seen anybody with that history, even in my family. So it was devastating. Even during the process of treatment, I was so down. I didn't know how to cope with it, even the mental health. Because by then, like now we have so much people support groups, but during the time, there were no support groups that I had known. I didn't know anybody who had cancer, so I thought I was going to die. But what I did, I went to a church and I became part of it. That's where I got consolation, and they walked the journey with me, and their family also walked with me. Yeah.
All right. So, interestingly, living now as a cancer survivor, what was the experience like during the pandemic? Seeing that there was a lot of information on COVID-19 and people living with NCDs and how it affects them, and knowing that you're a cancer survivor, that something could happen. What was the experience?
Okay, my experience was a bit challenging because when COVID came, people forgot about any other diseases and any other things, and it was so scary for us because we were told those people with underlying conditions, they were at risk of getting COVID. At the same time, they will even die immediately after contracting COVID. So I was very careful. I was scared at first. I could not even get out of my house because I was like, I had this condition. Even if I'm declared cancer-free, my immunity is not that strong. I'm not like any other person who is out there. Maybe they have never had any problem with their health. But as for me, I'm very sensitive. I don't know what will happen. It was scary. At first, even we went to the rural home. That's when I was a bit calm because in our rural area there are not many people, so you'll not interact with a lot of people. We were like in the house. Even people around us were scared of us because we have come from town, so we were indoors all the time. Yeah.
Interesting. What did you say were the major challenges in terms of even just the stigma of coming from town, already, having a disease, the immunity is not so strong? How did that look like when you went now to the village? You're like, hey, we've come here to be safe, but what are the people saying?
People were scared of us. They didn't even want to greet us. It was like, they will even pass by and talk like you have come to kill us, and at the same time you're feeling like I have this underlying condition. If they could know why I have come here, they will not talk like that. It was so hard, you know. At first there was a lot of stigma. Maybe when you come from the urban and you go to the rural area, there was a lot of stigma. They were like, they don't want to associate with you. Even if you go to a shop, they are just like, you are from Nairobi. I'll not. Yeah, they were even scared of selling their things to us. Yeah.
I see. So I guess moving on from that is even with the organization that you run now, do you think that we learned as a people, as organizations, as societies of people living with NCDs, do you think we learned from COVID-19? And if we learned, what are the lessons that we learned that you could share?
Okay, we've learned a lot of things, because now we came to know that us, the people living with NCDs, we are at risk of getting other things if they come up. Maybe our immunity is so compromised, so we need to take care of ourselves more, like maybe in terms of nutrition, even in terms of other things, because we don't know what will happen tomorrow. Maybe there is another pandemic, we don't know how to go about it. All we would like people to know is information. Just get the right information at the right time, what to do and how to prevent yourself from getting more complications, maybe coming with other things. Yeah. What would you say that you've learned as as an organization, even as an individual, really, living with NCDs, that you could advise, especially the public, to understand about the disease and the condition and how to take care of us during events such as the pandemic? Okay, I would like to educate masses that maybe you have this patient, maybe they are suffering from this disease. Don't stigmatize them during certain periods. Just love them, take care of them. Like in our case, when we went to urban area, to rural area, we didn't, because of the lockdown, we did not even have something to eat, because we stayed there was lockdown. But the people who are in the same situation as mine and they were in Nairobi, they were sending me food because they knew that I could not stay there without food. Even it did not come from the family, but the people, maybe those who are suffering as me, maybe those who have undergone cancer, they understand. Maybe they know if I lack that food, it will be even more worse than it is. So I would like to educate masses that even if something come up, we don't know what will happen tomorrow. Just take care of those people who are living with NCDs, even in terms of mental health. Yeah, when I was there, I was like, it's like I was depressed somehow, so my mental health was not that good. So I would encourage even the institutions to come up with a plan of helping people living with NCDs in terms of their mental health, their nutrition, because it's very crucial. In terms of maybe there is something that has come up, they will be more prepared and more positive on what will come.
All right. Last question. If we had another pandemic come up next week, for example, do you think we are ready?
I don't think we are ready, because we saw what was happening. At first, you could see people wearing everything, even during the funerals. Some people are buried at night. So, like now, it's like we have moved on. We don't know now what we'll do, even when another pandemic come up. So I urge the government to put measures to cushion people, even to cushion the people who are suffering from NCDs and any other diseases, because we are more vulnerable. sometimes when it comes, it hits us a lot. Cause like when the COVID came, we could not access medical attention. Like me, even if I'm cancer free, I still have my clinic at Kenyatta National Hospital. But like with the lockdown, I could not access. So I will urge even the government to put measures where even if there is another outbreak of something, to put measures that even people who are suffering from diabetes, from cancer, they could access medical attention even during that time, not only to concentrate on the maybe a pandemic, but also to concentrate on other diseases, because many people passed on with other conditions because they were neglected. They concentrated so much on the COVID and forgot about other things. And even after the pandemic is over, like now we can see it's like it's coming down. So they are supposed to maybe come up with a plan on how to deal with those people who has suffered even during the COVID and after COVID, even the mental health.
Yeah, I think that's a very important point that you raised, that the care should be, the government should have a preparation plan for something like this, that they're able to take care of our physical health, but also that our mental health. And then also sustain, like in terms of basic needs, food and shelter and clothing.
Yeah, true.
All right. Thank you very much for coming on board and for sharing with us a bit of your experience and also a bit of your lessons and learnings from the pandemic.
Thank you.
It was nice to have you.
Thank you.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.